Are you sure?
So Riley, how do we start this, buddy? You remember how we do it? We go, what's up, guys?
What's up, guys?
This is Riley.
This is Riley.
So you might be wondering why we are shooting this in our home. And it's because it was a really busy week and I wasn't able to shoot the Innovative Dental Smile of the Week. So we are doing it right here with the whole family in our house. And you might be looking behind me and seeing some of the laundry that's not quite put away. My wife would kill me if she knew I was doing this. She's actually out with an interview right now with, or doing interviews with some of the people that we've had the opportunity to transform their smile. So that'll be kind of cool to see those. So I think I may have not enunciated very well and might have said, well, everybody's commented and said it's Baxter, but it's actually Dexter. So this is Dexter. And yes, he is named after the serial killer, Dexter. Love that show. So his middle name is Dexter Morgan Olson. So he is Morgan. This is, yeah, Dexter Morgan Olson. So we went on. What are you doing? Riley, you want to come sit with me?
Yeah.
He wants to be on YouTube. He wants to be the next star on YouTube right here. All right. So here, let's start off right. Gabby, do you know how to do it? You want to do it? You want to go play?
I'm gonna go play.
Okay, go play. Say bye.
Bye.
Okay. In this episode, episode 2 of Innovative Smile of the Week, we'll show you this smile transformation and how we were able to give this lady 4 teeth that she knocked out from an ATV accident. What's up, guys? This is Dr. O from Innovative Dental, here to show you the next smile transformation, episode 2 of Innovative Smile of the Week. Here is an awesome transformation that I can't wait to show throughout how we did this. We used some really cool technology. Those who are maybe missing a tooth, this is gonna be a great episode for you. Those who maybe aren't super happy with the way that they've had one tooth restored or a few teeth that maybe have been damaged. By the way, in the comment section below, if you've had an accident that has caused trauma to your teeth, whether it be a fall or baseball. I think we've had moped accidents. We've had an ATV accident, which is today. So we've had some different accidents that have caused people some serious damage to their front teeth, playing around, maybe like a sibling. So give me your story. Let's share some cool stories of accidents and how you've had them fixed. I don't know, accidents. They happen, right? I mean, Hallie, didn't you chip one of your teeth? Yeah. My daughter's right here. She's trying to be shy, but you want to say hello? Show them your braces. Hallie's got some awesome braces. This is my 7-year-old, almost 8-year-old Hallie. She's got some braces. Gabby, let's see your braces. Let's see them. Oh, you're gonna shake the camera. You are shaking the camera right now, sister. Come show them your braces. I know it's recording. You don't have to. Check it out. There's Gabby and her braces. If you haven't already, would you please subscribe to the channel? That way you don't miss a single video of how we share these smiles or any other topics that we might discuss about dentistry. We try to have a little bit of fun at the same time, so hopefully you'll subscribe and that way you don't miss a single thing. Let's go ahead and dive right into this transformation. I will go through the techniques and how we did this as much as I can. For those who just are like, you know what, I don't care about how you transform the smile and all the details. I just want to see how this lady looks after you fix that smile. You're going to want to go to like the last minute or 2 of this video to catch that. For everybody else who's kind of curious, go ahead, stick around. First things first is when you look at a smile and you want to transform a smile, you have to figure out the plan, right? What is the end game? What do we want this smile to look like? And when you're missing this many teeth, we really need to start with a very clear plan of what we want the smile to look like. So what we did is we did that. We took an impression, got this plan, and we transferred it to her teeth. So there you can see the plans transferred to her teeth and how the smile should look, just shape-wise, obviously. Not shade or anything, but just the shape of those teeth. Then we take a special 3D scan. That 3D scan shows us all of the jaw density, the size of the ridge, and where we could actually place those dental implants to help restore that site. Along with that, we're able to visualize not just the bone, but the scan that we have with those blue teeth. You might be able to see that there in the software. That is a plan of where those teeth should be in software. So in this 3D environment, what makes guided implant surgery so awesome and so valuable is that you can see not just the safe placement of the dental implant, but you can see the prosthetic or the fake tooth that's gonna be screwed into that implant, and make certain that they all work together really well. That way the smile is predictable. I can't tell you how many times I've seen very experienced dentists, surgeons, that maybe placed something that didn't line up perfect. And that's why we want to use technology now that we have 3D x-rays to do that. So that's the importance of 3D planning. Then finally, after we make a perfect plan, so hey, this is a 3D environment, this plan looks awesome, we should be able to give this patient a great smile. That's not good enough, right? Because that's just a plan. How do we make that actually happen in treatment? So for those who are having a little bit of an aversion to blood, you're gonna wanna go to past like another minute or two. For those that don't mind, I tried to keep it a little amount, but we obviously have to cut the tissue to place these implants. So you're gonna see just a little bit of blood. I know I shouldn't show that. It's like rule number one, don't show anybody blood. But the reality is that you're gonna bleed a little bit when we cut your gums to place an implant. So here you go. Here is the guide in place. So I wanted to show you the guide is what's gonna control those. There's little rings. See those little silver rings in the guide? Those silver rings are going to control the placement of the implant to exactly where we planned it in that software, in the 3D environment. So now I can go into this process with 100% certainty that I'm giving that patient exactly the ideal treatment that I planned in software. So I use that guide. You can see here now the implants are placed in the ridge. You can see the little tissue punches rather than this large surgical incision and flap, which is why the patient's gonna have a lot less post-op pain and discomfort. Then you can also see that we prepped those teeth around that because we want to match, right? So it's great to do implants, but implants are so permanent. The shade is going to be the shade that we put it. We did a video about staining veneers and porcelain. You can check that out here above. But that video proves that these materials don't change shade. So if we do them and we match your teeth and you want to bleach your teeth, you want whiter teeth, then you're kind of stuck. So, or you have to pay to have all of these redone. Okay, you want to play basketball, Riley? What's up? Come on, bud. You want to sit with my lap for a minute?
Yeah.
Okay. Riley wants to help out, and I guess it's March Madness, so.
Play basketball downstairs.
Play basketball downstairs. Man.
I need to go potty.
You need to go potty. So we're potty training Riley right now. Is anybody else potty training their kids right now?
Potty.
This is our 3-year-old, and it's like we totally forgotten. It's pretty challenging to potty train. You need to go potty? I'll be right back. I'm gonna go take him to the bathroom. I'll be right back. Now it's time for a basketball break. All right, took care of that. Riley is definitely, he'll get it someday, right guys? Please tell me he's gonna get it. He's not gonna pee his pants when he's 6 years old. I'm hoping. Anyways, there's hope, there's hope. All right, now let's get back to the story of this awesome smile transformation. Here I can show you where we wanted the implants to go in that plan. And then below that, you can see where they actually went. Isn't that cool? They're exactly the same. And that's because this technology is very predictable and very safe. It also gives us obviously better aesthetic results. And that's really ultimately what the patient cares about is how's this gonna look when we're all said and done. Now that we've done that, we have some amazing technology that allows us to scan. And I think I was talking about, I think I've left out a little bit about the shade. I got interrupted by potty training Riley, but the shade aspect. So when you do these implants, you want to make sure that the shade is going to match what you want the smile to look like. So this patient, we recommended that we do some veneers. She went ahead with that. We did one crown, you can see there because of the decay on that one tooth. And then we went ahead and veneered the other teeth to make certain that those pieces of porcelain matched her new implant crowns. Now that we have those implant crowns designed in the software, and you can see these other images of how we were able to take pictures and make those screw accesses to the implant, make them on the back side. You're so cute, bud. I love you, man. Give me a kiss. Give me a kiss. You're so sweet. You're awesome.
Yeah.
You're awesome. You just want to be part of the video, don't you?
Cheese.
Yeah, cheese. Okay, all right.
Bye.
Bye. Bye.
You can take that.
Bye. Okay, take that. Okay, take your step stool, whatever. Okay. All right. So back to.
There.
You know, I'm sorry I'm getting interrupted a lot, but this is life, right? This is what happens when you get to record at home because you had a busy week and couldn't get it done at the office. But we're gonna go ahead and finish this smile here. Now that we've planted it all in the software, we're able to mill the pieces of porcelain for the veneers and those implant crowns, screw those into the patient's mouth the very same day. How awesome is that? Here's the smile the same day. So you can see we even shaped those gums. I usually don't show this because it's not the most beautiful result right same day because the gums are red and irritated from the fact that we had to cut through them. But you can see that we did a pretty decent job of making those gums look fairly natural. And then here is her smile before and after. What a fun way to fix a traumatic accident like this ATV accident. I really hope you enjoyed this smile transformation. She's an awesome lady. I'm wanting people to maybe see this and maybe hopefully go, gosh, I wanna go to a dentist that is using the latest, so that way I get the best result. That way it's safe, that way it's accurate. And that's really the insight into this smile transformation, is this lady now has a smile that is really something she can be proud of. All right, so that ends this week's smile transformation. What we're gonna go over next week's gonna be fun. This lady came all the way from Puerto Rico for her smile transformation. And in the comments below, I'm gonna show you her photo. This photo right here. What do you think we used to transform her smile? Was it veneers? Was it crowns? Did we use implants? Did we use Invisalign? Or is it all of the above? Go ahead and comment below if kind of your guess on what we used and maybe how you think we could have transformed this smile. And then next week, I'll reveal how we were able to transform her smile. So pretty fun story with her. All right, if you've stayed tuned till now, would you consider smashing that thumbs up button, hit that like button, and then also consider subscribing if you haven't already. That'd be awesome. I'd really appreciate it. Consider sharing it with a friend. That way, more people can learn about some of the advanced dentistry that is available today. If a smile transformation like this is something that you would love to see what we can do for you.
A cupcake.
A cupcake, thanks buddy. Thanks.
I can put a cupcake.
Okay. Love that kid, so awesome. So if this was something you're going, man, I could really benefit from implants and cosmetic veneers, we would love to see you at Innovative Dental. Don't hesitate to give us a call or email us. We'd love to see what we can do to help you transform your smile. We help people from out of town all the time, and we can help make that arrangement easy for you since we do most of our treatments in 1 or 2 visits. So otherwise, you have an awesome week ahead. I look forward to seeing you in the next video. Until then, you keep smiling.